Welcome everyone to the Government's daily briefing. I'm joined today by the Chief Executive of the NHS Simon Steven and the Deputy Chief Medical Officer Jenny Harries. I'd like to update you all on the facts on the spread of COVID-19 and the steps that we are taking in the battle against the coronavirus. 113,777 people have now been tested for the virus. Of those, 14,543 have tested positive, an increase in the last day of 2,885. The best scientific analysis now is that the rate of infection has been doubling every 3 to 4 days. And of those who have contracted the virus, 759 have sadly died. Our thoughts and prayers are with the families of those who have passed away. These figures are a powerful reminder of the need for all of us to act. We need to slow the spread of the virus and strengthen the NHS's ability to protect us all. Strict social distancing measures have been put in place to restrict the spread of COVID-19, so fewer people should need hospital treatment at any one time. The measures that we've put in place follow scientific and medical advice and are designed to reduce the rate of infection. And as well as acting to slow the spread of the virus, we're also acting to strengthen the NHS. We're expanding the number of beds available for new patients, we're increasing the number of staff in our hospitals, and we're also investing in life-saving equipment for those with severe symptoms to give people the care they need when they need it most. I'd like to thank all those involved in this effort to reinforce the front line in the battle against the virus. The military personnel who are helping to fit out a new hospital in East London and are helping to distribute personal protective equipment. The amazing doctors, nurses and support staff in our NHS. Those in manufacturing who've risen to the challenge of producing new ventilators. And the hundreds of thousands who've volunteered to help in innumerable ways. This is a united national effort, and the spirit of selflessness shown by so many is truly inspiring. And this virus, of course, affects us all. As you're no doubt already aware, the Prime Minister has coronavirus and is self-isolating at home in Downing Street. He began experiencing mild symptoms yesterday afternoon and was tested on the advice of England's Chief Medical Officer, Professor Chris Whitty. The Prime Minister is continuing to lead the government's response to coronavirus, chairing meetings and communicating with key members of his team through video conferencing. And earlier today, the Prime Minister led the effort in launching our latest front in the fight against COVID-19. Today, I can announce that the Prime Minister has brought together businesses, research institutes and universities in a new alliance to boost testing capacity for frontline workers. Increasing our testing capacity is absolutely crucial in our response to and our fight against coronavirus. This is a particular priority for those who work in the health and social care sector and are working so hard to keep us all safe. This will be antigen testing, testing whether people currently have the disease, so that our health and social care workers can have security in the knowledge that they are safe to return to work if their test is negative. These tests will be trialled for people on the front line starting immediately, with hundreds to take place by the end of the weekend, dramatically scaling up next week. And of course, protecting our frontline workers is at the forefront of everyone's minds at the moment. Last night, millions of people paid a fantastic tribute to the heroes and heroines of the NHS when they stepped outside their front doors and clapped our carers. And alongside those in health and social care, I also want to thank those who work in food production and retail, those who work for the Royal Mail and public transport, our teachers and our social workers. They all deserve our gratitude. And having talked to trade union and business leaders, civil servants and public-spirited volunteers, and of course ministers in the devolved administrations in Scotland, Wales and Northern Ireland in recent days, I want to record my admiration for the national solidarity being shown in the fight against this disease. All of us can support our NHS by continuing to follow the guidance, to stay at home, to protect our NHS and to save lives. And I'll now turn to the Chief Executive of the NHS, Simon Steven. Simon.
Thank you, Michael. today, over 6,200 confirmed positive coronavirus patients are in hospital across England. And we know that number is only bound to rise over the coming days. That's why, as Michael says, it is so important that everybody follows the medical advice to stay at home and in so doing save lives. But it's also why the NHS is making an extraordinary effort right across this country to ensure that we have care for those patients who need the looking after from coronavirus. That's why NHS staff are pulling out all the stops in an unprecedented response to this global health emergency. As of today, across England, we have reconfigured hospital services so that 33,000 hospital beds are available to treat further coronavirus patients. It's also why we are taking the extraordinary action to build new hospitals in very short order, starting with the NHS Nightingale Hospital in East London. And today, because this is a problem, of course, not just confined to London, but across the whole country, I have given the go-ahead to the building of 2 further of these NHS Nightingale hospitals, beginning at the Birmingham National Exhibition Centre and the Manchester Central Convention Centre, with further such hospitals to follow. In doing that, I obviously want to pay tribute to the contribution not just of NHS staff, but the support that we're getting from volunteers, from the armed forces, from social care, from all of our partners. It is remarkable, I think, that in just the last 2 weeks, we've seen 18,000 doctors and nurses return to practice on the General Medical Council and the Nursing Medical Council registers, answering the call to arms. And it was therefore very gratifying for our staff across the NHS to see this remarkable outpouring in the Clap for Carers last night. For many nurses coming home from a day at hospital, or for other staff returning to start again for the night shift, it will have meant an enormous amount to know that the whole country is behind them. But the best way we can show that support, of course, is actually by doing what it will take to reduce the rate of infection, because even simple actions following this advice will save lives.
Thank you very much, Simon. I'll now turn to the media to take questions. And I think our first question is from Vicky Young of the BBC. Vicky.
Mr. Gove, the Prime Minister has coronavirus. The Health Secretary does as well. The Chief Medical Officer is in isolation. People will be looking at this and may be wondering whether you haven't been taking your own advice or you maybe acted too slowly when it came to stopping the spread of coronavirus. Another question, please, to Sir Simon Stevens. We've had cancer patients getting in touch with the BBC today, very worried about the cancellation or postponement of their treatment or operations, many of them worried that their own lives may be being put at risk. And a question for Dr. Harris, if I could, can you be more precise about the peak of this outbreak?
Well, thank you, Vicky. I'll turn to Simon and to Jenny in a second. I think the fact that both the Prime Minister and the Health Secretary have contracted the virus is a reminder that the virus does not discriminate. We are all at risk, and that is why it is so important that we practice social distancing measures. Those are in place in government. Ministers are working remotely and from home using video conferencing in order to make sure that we can follow the strict advice that all of us should be following in order to help to protect the NHS. Simon.
On the question of cancer care, we've been clear that we do want essential and urgent cancer treatments to continue, but that cancer specialists should have the opportunity with their patients to decide whether it is more risky for somebody to embark on treatment at this particular time, given that you are more vulnerable to infection if you begin a course of treatment, perhaps chemo, or become immunocompromised as a result. So those are clinical decisions that will need to be taken. We've also agreed a landmark deal with all of the independent hospitals across the country, which has given us the ability to look after patients away from the busy hospitals that are treating coronavirus. And in London, for example, the Royal Marsden is therefore coordinating cancer care right across the capital so that even if patients aren't being looked after at their local hospital, they will be getting the care they need. But these are very difficult and sensitive judgments that need to be made with the full involvement of cancer clinicians as well as patients.
Thank you, Simon. Jenny.
Thank you. Yes, I'm going to be a little bit repetitive. The same question I think was asked yesterday from a different media colleague. It would be very foolish of me, I think, to predict precisely when we expect the peak to be, not least because we have put in social distancing interventions and we are looking to see how well they work. As I said yesterday, there's some early indication that the public are really now heeding that advice, and we thank them for that. It's really important that they continue to do that. We do not expect to see a significant change in our numbers for 2 or 3 weeks, and so we really need people to stick with us and stick to those social distancing interventions for that period. We are, of course, monitoring that data daily, and we will obviously, when we've got a firm prediction, then we'll be happy to share that with you.
Thank you. Thank you, Vicky. I'll now turn to Carl Dinnan of ITV.
Thank you, Mr. Gove. Obviously, it's good news that we've heard that the Prime Minister is only experiencing mild symptoms, but I'd like to know, what is the plan should the Prime Minister not be able to continue with his work? And also, given that there does seem to be a limit to the number of tests that can be done, what is the system for testing people like yourselves at the top of government who are dealing with this crisis?
Well, Carl, the Prime Minister has only mild symptoms. He took part in, he chaired a video conference earlier today, and he was able to marshal the resources of the NHS and different government departments, and indeed of the private sector, in order to bring forward the testing initiative that we've announced today. But I'll hand over to Jenny to say a little bit more about the testing protocols that guide the way in which people are tested, and a little bit then I'll turn to Simon, forgive me, to say a little bit more about our ambitions to support frontline NHS staff with the extension of testing. So Jenny, first of all.
Thank you. So as I stated previously, the primary objective of all of our testing is to ensure that we manage clinical cases safely. So those patients who are admitted to intensive care with acute respiratory disease syndrome or with pneumonia are the ones we're focusing on, and again for other admissions into hospitals with those conditions. We test routinely in some other very specific areas, so care homes, for example, where we know that there are critical patients at risk, at higher risk, and where there is a higher risk of disease spread. The basis of all of this is, firstly, that you must have clinical symptoms. The default position without that is you would not be tested. And then the only other criteria would be the centrality of your role to the COVID-19 response. In this particular case, I'm sure your viewers will understand that the Prime Minister plays a very critical role in that, and that's the basis for our testing.
Thanks, Jenny. Simon.
Well, from an NHS perspective, we think it is urgently important that we are able to test frontline staff who are off sick or otherwise isolating. And that's why the work that Public Health England has been leading is so important, because it means that we're going to be able to double by this time next week the number of tests compared to the number that we've been doing this week. And so I can say that today we're announcing that we will be rolling out staff testing across the NHS beginning next week, starting with the critical care nurses, other staff in intensive care, emergency departments, ambulance services, GPs, and as the testing volumes continue to increase, we want to expand that to a wider range of essential public service workers, including our social care services, as well as, of course, continuing with the patient testing, which is so vital.
Thank you, Simon. We'll now turn to Beth Rigby from Sky.
Hi, can you hear me? Sorry.
Yes, we can, Beth.
Mr. Gove. Just a couple of questions, please.
Yes, of course.
Mr. Gove, you say the Prime Minister and the Health Secretary getting the virus shows it doesn't discriminate. Unfortunately, they only have mild symptoms. But you can't guarantee that they won't become more poorly at the very moment that the country and the NHS most need them to lead. Lots of people watching this will be asking why the Prime Minister, the Health Secretary, and now the Chief Medical Officer weren't better protected. Isn't this at best careless, and at worst, negligent? And to Simon Stevens, a couple of questions, if I may. The new London hospital will have 500 intensive care beds by next week. How much spare capacity is there in London's critical care beds today? How do you expect that to change over the weekend? And do you anticipate you'll be over capacity by next week? And just on the testing and NHS staff, great news that you're going to roll out testing, but how many NHS staff are currently unable to work because they're either unwell or self-isolating? Thank you.
Thank you, Beth. The fact that the virus is no respecter of individuals, whoever they are, is one of the reasons why we do need to have strict social distancing measures so that we can reduce the rate of infection and reduce the pressure on the NHS. There have been various estimates about the number of people in any country who may become infected over time. We aim to, as the Prime Minister himself has pointed out, flatten the curve, reduce the rate of reinfection in order to ensure that the NHS can be protected. And I think that many people will reflect on the fact that the Prime Minister succumbing to the virus is a reminder of how seriously we all need to take the advice that the NHS has been giving us. Simon.
Thank you. Yes, so on the question of London hospital beds, as of yesterday, the most recent figures, we had just under 3,000 empty and available hospital beds across London. And as you say, Beth, we are bringing on additional beds next week at the new NHS Nightingale Hospital. That is being configured initially to be able to look after up to 500 patients, but there is the physical capacity to potentially take that to up to 4,000 if it were required. So there is obviously an enormous effort going on, not just across London, but across the Midlands as well, where we're seeing continued growth in cases. And that's why, as well as freeing up the 33,000 hospital beds across our current English NHS hospitals, we are also taking these unprecedented steps to build in a few days hospitals that would normally take years.
Thank you very much. And we'll turn now to Andrew Woodcock from The Independent.
Mr. Gove, there are large numbers of people around the UK who are reliant on food distribution through food banks and other charitable efforts. These charities are still working, but many food banks have closed and donations are down. Many volunteers are over 70 and they've been advised to stay home. The Independent's launching a Help the Hungry appeal to support the London Food Alliance, but there's a need right across the country. The government says it's supporting all sections of society through this crisis. So is there going to be financial and logistical support for these charities? Are any of the 700,000 people who volunteered to help the NHS being committed to this effort? And Sir Simon Stevens, could I ask, you've been head of the NHS since 2013. Do you regret the bed reductions and the failure to increase nurse training numbers during your tenure, which have left the NHS in a position where it entered this crisis with its critical care bed base amongst the worst in Europe, with Italy, for example, having twice as many ICU beds, and the UK having the lowest number of nurses and doctors per head amongst developed nations, according to the OECD? Isn't the lesson from this crisis that the NHS needs more capacity at all times if it's going to be ready to deal with this kind of surge in demand, and it can't be made to operate with no slack as it has been under your watch?
Andrew, thank you for those questions. On food and helping the vulnerable, let me say a few things. The first thing is I want to thank all those who work in food production and in our supermarkets for rising to the challenge of making sure that our shelves can be refilled and that people who need it are able to get the food that they need. Now, of course, we need more than simply to have an effective food production chain. We need to make sure that those most in need, those who are self-isolating, get the food and the other support that they need. That's why the NHS has identified up to 1.5 million people who are shielded, who've been advised to self-isolate for 12 weeks. And it's why government departments working together are ensuring that there will be food distributed direct to those individuals, with community pharmacies also providing the prescription medicines that they need. Now, there are people beyond that 1.5 million who are not self-isolating for 12 weeks, but who are vulnerable, people who in the past have used food banks, people whom we need to support now. And it is the case that the volunteer networks that have been set up across the country are ensuring that we can match volunteers who are willing to go shopping and to hand food to those vulnerable people who are staying at home or who may not themselves have the social networks to get the food that they need. And of course, the tremendous response to the Good Sam initiative that Matt Hancock announced earlier this week, with hundreds of thousands of people stepping up, is an amazing example of voluntarism in action and national solidarity. And we will be doing everything we can to support them. And my colleague Oliver Dowden at the Department of Culture, Media and Sport is looking at a specific fund in order to support charities in the work that they do. And we'll be saying more about this in the days to come. I also want to thank those people in the hospitality and catering sector who have stepped up and who are doing everything they can to support the vulnerable. John Vincent of Lyon is making sure that his stores remain open as takeaways in order to support the NHS. It's that sort of collaboration between citizens, the voluntary sector, backing from government, and enlightened business people that I think will help us to beat this virus. And I'm grateful to you for the opportunity to thank all those who are making that contribution. I'll now hand over to Simon.
Thank you. So the NHS does need more staff and it does need more hospital beds, and we've been saying that for some time, and that is what's going to be happening over the next 5 and the next 10 years. But the reality is that what I've described is that over the last several weeks, we have freed up the equivalent of 50 hospitals across England ready and waiting for coronavirus patients. Under normal circumstances, you would not keep 50 hospitals fully staffed with nurses and doctors not actually looking after patients, which is why no health service in the world, anywhere in Europe, anywhere internationally, would be able to withstand a coronavirus epidemic unless the sort of measures that the public are also involved with are also put into place. And that's why it's so important that the public support the work of our very pressurised frontline nurses, doctors, therapists and other staff across the NHS by staying at home and in so doing saving lives.
Thank you. And we'll turn now to Tim Ross from Bloomberg.
Thank you. Michael Gove, we were told before the decision was taken on Monday to impose much stricter rules on people's movements that decision would be based rigorously on the data around footfall and public activity and transport. Yet, despite asking every day this week, the government has not so far provided any of that data to justify the most sweeping restrictions on the population the country has ever seen. Will you promise now to publish that data? And could you explain why it hasn't been published so far? To Sir Simon Steven, can you guarantee that the NHS is ready for what's about to come? And if not, what is the one thing you still need from the government to prepare yourselves?
Thank you, Tim. On the data, at every stage, we have followed the scientific and medical advice that we've been given, and we believe that we've taken the right steps at the right times. And the evidence shows that since the measures that we took on Monday, the British public have responded in a fantastic way. And we've seen a dramatic decline in the use of public transport, allowing public transport to be increasing the preserve of key workers. We've seen a decline in footfall, and people are, the overwhelming majority of the British people are following the strong advice that has been given in order to protect our NHS. And of course, we will share that data with you. One of the features of today's briefing was the set of numbers that I and Simon shared with you. And of course, we will share figures, share data in a spirit of transparency so that people can see that we are doing everything that we can. But I'll hand over to Simon, first of all, to answer your question on the additional help and support that we can give the NHS.
I honestly believe that everybody across the NHS is doing everything that can possibly be done to ensure that we're able to best look after patients who need our care during this coronavirus pandemic. One of the points that I think has been particularly remarkable actually over the last several weeks is the way not only the NHS but all public services have come together. That's true for local councils, that's true for care homes, it's true for the voluntary sector. And across government, we have had the support of the Ministry of Defence, we've had the support of other parts of government helping us prepare in different communities, because as Michael said a moment ago, we earlier this week wrote to up to 1.5 million people asking them to take special care given their background health conditions. And for them to be able to stay at home in that very self-contained way requires people who can help with shopping, who can help collect medicines from the pharmacy. That's an enormous team effort that the NHS by itself can't do, and we are getting that support.
I might just ask Jenny just to say a little bit about data, social distancing measures and the appropriateness of the steps that we take. Jenny.
Thank you. So I think, as we've said, we've been trying to be transparent with this, but very confident that at all stages the government has acted on the science. It is an unprecedented event, as I think we're all recognising, and there is some degree of uncertainty with this. So with some of the data, as you acquire the data and the steps go into place, actually your data changes. So the earlier conversation around when will the peak be, well, it depends how successful we are. So there is a bit of a moving agenda on some of the data, but absolutely clear that we have acted, we have looked at the modelling, we have taken those interventions in order, which we know will produce the biggest impact, and we have steadily implemented those. And the last ones, of course, in relation to strict social distancing and particularly the shielding of very, very clinically vulnerable people is an important step to time appropriately, not because, just least because of the risks of them with coronavirus, but because they have multi-morbidities, they have other problems, and they need a lot of social support. So in this country, we have timed them really carefully to ensure that those social support systems are around to maintain them through the period of isolation.
Thank you, Jenny. And I'll turn now to Hugo Guy from the I newspaper. Hugo.
Mr. Gove, it sounds like you and your cabinet colleagues are not going to be automatically tested for coronavirus, despite the fact that the Prime Minister and the Health Secretary have tested positive. Can you confirm that that's the case, that there's no plans to test all of you? And if so, explain exactly why. And can I ask, I think this is probably a question for Dr. Harries. We've heard a lot about the prospect of getting kits that can test for whether or not someone has ever had coronavirus. We're told that 3.5 million of those are on order. Can you clarify, have those kits already been manufactured? And if so, by whom have they been manufactured? What company is producing those? Thanks.
Well, thank you, Hugo. People are tested if they are symptomatic, and those members of the sort of central effort in helping to defeat the virus who do show symptoms are appropriately tested. But I think you can tell from the fact that the three of us are here demonstrates that there are three of us who have not yet demonstrated any symptoms. But it is important in order, as we mentioned earlier, to try to ensure that we slow the spread of the virus, that everyone, wherever possible, practices the appropriate social distancing disciplines that we've announced earlier. I'll hand over to Jenny and also to Simon just for a final word as well. Jenny.
So actually I might just add to the points you've just made. So as I said earlier, we have very clear testing criteria. So we would not, in the early phase of the outbreak, we would have strong containment and contact tracing mechanisms. That is not appropriate at this point in the epidemic in the UK, but we will test appropriately for clinical management. The appropriate thing to do if you have symptoms is to self-isolate and remove yourself from the environment so you can't potentially transmit disease to anybody else. And that applies just as much to the cabinet members as it does to myself or any other part of the population. The only other criteria would be about the centrality of your role to COVID-19, and it's exactly why Simon has highlighted the importance of testing our workforce and other first responders as well, who are keeping the response going. In relation to the 3.5 million testing, the have you had it as opposed to the have you got it test, they are coming from a variety of different manufacturers, and I think, as Professor Whitty has said before, it is really critical that each of those ones is tested. We test the sensitivity and the specificity of the test, so how frequently we can pick up the disease, and then how sure we are that it's a true positive test. And each of the different types of those testing kits will be evaluated.
Thank you, Jenny. I'm going to leave the last word with Simon. Simon.
Well, I think it's simply to say that, unfortunately, pressure on the NHS is going to intensify over the coming weeks. There's no doubt about that, before things hopefully begin to improve. And so this is going to be a time when a lot of our frontline staff are going to be in highly stressful and pressurised circumstances. But I think what they would want me to say to the rest of the country is know this, that everybody is pulling out all of the stops to do the right thing. And if you can help too, by following the measures that have been set out, staying at home, you will save lives.
Thank you all very much. Thank you.